Does anyone know where the term lesbian came to be? And actually, that's right. So, has anyone of you heard of Sappho before? Oh, sorry. Sappho is an ancient Greek poet. She was a very well-known poet and popular, and her poetry explicitly depicted sexual interaction with personal relations with other females. And Sappho was a lesbian, but she was a lesbian way before the term lesbian came to mean homosexual women. She's a lesbian because she is from the island of Lesbos in the Mediterranean Sea, not too far from Lebanon. And just like any other man or woman from that island, they're referred to as lesbians. I always find it amusing that some men from the island were protesting to ban the use of the term lesbian to refer to homosexual women. Of course, it was futile, nothing happened. So I have no financial disclosures or any conflict of interests. I'm going to start with a historical background. In 1973, the American Psychiatric Association removed homosexuality from the DSM. And this was followed 20 years later by the World Health Organization removing homosexuality from its list of mental disorders. In 1999, the Institute of Medicine, sponsored by the NIH and the CDC, published a report documenting the paucity of lesbian-specific research and promoting such research in the future. And in 2000, sexual orientation was recognized as a social determinant of health in a United States 10-year public health plan. Now this was, of course, they did not achieve their goal in 2010, and sexual orientation continued to be on the 2020 Healthy People. Now we already know that lesbian patients are frequently invisible in our practice as physicians, and our attitudes as doctors can affect our care to our patients, especially if our attitudes are homophobic or heterosexist. This is according to the Society of Obstetricians and Gynecologists of Canada. The Gay and Lesbian Medical Association has always pushed for cultural competency training specific to LGBT populations to be part of training curricula. And they also encourage LGBT health questions to be included in licensing exams and medical boards. And in 2004, the NIH has urged healthcare professionals, the NIH urged associations and institutions to disseminate information about lesbian health to healthcare providers, to researchers, and also to the public. Practitioners have the responsibility to provide quality care to all women regardless of their sexual orientation. You would think it's common sense, but it's not the practice usually. Providers of reproductive health care and family planning services should not assume that patients, even if pregnant, are heterosexual. This is according to the American College of Obstetricians and Gynecologists. And to bring it a little bit close to home in Lebanon, in 2013, the Lebanese Medical Association for Sexual Health released a position statement that stated the following: homosexuality is not a disease. Origins of homosexuality are not known. Homosexuality is not a choice. Homosexuals are at higher risk for psychological problems, and attempts to change one's sexual orientation can be harmful. May 2013.